Castleman, and I'm joined today with Dr. Joseph Blackmon, and he's with Paducah Dermatology, and we're going to talk a little bit about skin care. So I told you this already, but we were at the beach a couple of weeks ago. My husband found a sand dollar, which is a big deal. They're not everywhere.
Sure.
And I posted it on social media, and more people were concerned with his sunburn than they were about the sand dollar, so it was kind of funny. And I thought about you, and I was like, oh, we didn't reapply. So even though the weather is cool now, we still need to be putting that sunblock on, right?
Very important. I mean, speaking from a father of 4 children who play fall sports, we're outside still, UV index is still high. So on those days, those Saturdays, those long Saturdays, Sundays, definitely important to wear that sunscreen, SPF of 30 or greater. And to your point, Robin, we reapply, every hour and a half to 2 hours. If you're wet, about every hour and a half is really important. That's where we really get people, and they get kind of burned, literally, is not reapplying. So kind of set your watch, and when that timer goes off, just reapply. Have somebody hit your back or areas that you can't get to. Really important, wear that broad brim hat so you're covering your ears, back of your neck. Those are common areas that I see skin cancer every day. So.
Well, and you mentioned something I would have never thought about, and we normally think about the sun, but those winter vacations like skiing, you can get sunburn from skiing.
Sure, yeah, they had studies that would actually prove the different powers of SPF, SPF 100 versus 30 versus 50. And it did show a little bit of statistical significance with that higher SPF, although we don't really see much in it clinically. So we always say SPF of 30 or greater for the most part, but it was in skiers. And so you get all that reflection off of the snow. And you had a patient that didn't have any sunscreen on versus SPF of 30, 50, and 100. And blistering sunburns versus the placebo or the no sunscreen. So yeah, even when it's freezing cold outside, below freezing, still wear that sunscreen year round, for sure.
So now that the damage is done and we are going into these cooler temps, it's a good time to have those things checked.
Sure.
And you mentioned like men that are balding on the top of their head and places like that, and things that we have had exposed. So how do we make sure that we get those spots taken care of?
Yeah, so we oftentimes call those kind of fields of cancerization. So areas that have been exposed to sun for a long period of time, they've got a lot of those rough areas, those what we call actinic keratoses or precancers, and they feel kind of like sandpaper. Sometimes they're better felt than seen with the naked eye. So now we're into the fall, early winter time. Those are areas where we really want to get aggressive with treating those spots, especially if there's a lot of them. So if you find yourself coming in to your local dermatologist and having a lot of spots frozen with liquid nitrogen, that would be a good time to consider the use of what's called topical 5-fluorouracil or Effudex, or imiquimod or Aldera. Those are topical chemotherapeutic treatments to treat those spots. They make you very sun sensitive, and so you really want to be aware of that. So that's why in the wintertime that's good for that, as well as photodynamic therapy. So definitely this is a good time of the year to start getting into that treatment of these precancers that unfortunately you've maybe exacerbated or started in the summer months.
Gotcha. So we can just call the office and they can work us in?
That's right. Anytime.
All right. Well, thank you so much. You're always a wealth of knowledge.
Yeah, you're very welcome.
All right. If you would like to revisit this segment of Health Experts, log on to WPSDLocal6.com and click Health Experts. Up next, a representative from Jackson Purchase Medical Center is going to be here with me, and we're going to talk about mental health. That's after this on WPSD Local 6 Midday.
Real